Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and I think this is going to be the last in the series of how to avoid a lawsuit or void complaint. We've been doing all kinds of other topics, perio, endo, you know, impacted teeth, etc., etc. I wanted to go a little bit more into phase one interceptive airway and expansion case oopsies, um, and how this is starting to tick, tick, tick a little bit up into a little bit more of where you can get yourself in trouble. And it's real nebulous right now in terms of what you can do and what you can't. But I mean, first of all, first thing you're going to check is check your own dental practice act if there's anything written in there, because one state might be different from another. Okay, but within that, if you look at the American Dental Association's position on airway and ortho, basically the AAO and the AAPD kind of joint released this statement in 2017 saying that the role of dentistry in the treatment of sleep disorder, breathing disorders mandates that dentists screen pediatric patients for signs of deficient growth, development, or other risk factors for airway issues during routine exams. That's something you need to be only doing every 6 months, every 12 months. They're saying that it doesn't matter if you're a general dentist or a pediatric dentist. If you have kids, you need to be doing that on every patient. So if you're not doing that and someone grew bad and no referral was made to either ortho or um, you know, uh, or ENT, then you could be in trouble, right? So that is like failure to refer is one thing, and they're saying to ENT too. Multidisciplinary approach. If a dentist suspects a breathing disorder, they are directed to refer the child to a physician, such as an ENT or a sleep specialist, for a definitive diagnosis. Again, if you see something, say something, do something. You know, they're saying you got to send them to the doctor. They're not saying don't just do an expander, is what I'm getting at. So again, you could get in trouble. Even if you notice something and you said, oh, I'm just going to do an expander. Well, they're saying, well, wait, if you thought that maybe this patient had obstructive sleep apnea, why did you not refer this patient to an MD and or ENT? That is what is standard of care. That is what I see most doctors not doing. Now, okay, realistically speaking, a lot of times, and is the research there to back this up? No, it's not fully there yet. It's starting to leak out, but it's not fully there yet. A lot of times we have these patients, we do the expander, we do the ortho, and guess what? Their symptoms get better. And we might be doing a subjective sleep screening and all that. And we're all good now. Are we all good on paper? No, because this is just subjective. We're not all good because the doctor hasn't diagnosed and the doctor hasn't said they're all good. That's what we're getting at. This is subjective. So again, if there were something down the road, this might blow back on you. Lastly, interceptive care. Again, you're allowed to treat ortho problems. You're not allowed to treat only sleep problems. Can you treat a patient that has sleep problems who also has ortho problems? Yeah, you can treat the ortho problems, which might help the sleep problems, but you can't just treat the sleep problems. So sleep is a medical diagnosis. Can't treat that without the medical diagnosis. That means the doctor actually does a diagnosis, says, hey, you need an ortho. Okay, cool. We can do that, right? We'll do the expander because doctor said we needed it. So the ADA recognizes that certain dental and skeletal conditions, such as narrow palates, can contribute to airway resistance, and that treating these without, sorry, this is really dark when I'm reading, treating these may be within a dentist or orthodontist scope of expertise. So it's okay for you to do expansion on patients that have possible airway issues if they need expansion orthodontically, narrow palates, cross bites, wear, lack of space to put their tongue, things like that. If you have a reason that you need to do expansion, by all means do expansion, but remember the right time to do expansion, and there's a whole nother thing on this, is once the first molars erupt. That's the right time. This early expansion, not standard of care. This goes back to who makes standard of care. Again, are you going to possibly get sued on this? This is probably I'm going to put this as very unlikely. But if down the road there was a problem and they audited the records, and now with all this, they're going to find out, oops, this doctor didn't quite do the things the way standard care is for ortho phase one and airway. So now you guys know. All right, thanks.